Hi, I'm Kamali, taking you through some of the things people are talking about and some other stuff they're sharing around the world on Newsfeed today. A vaccine for Covid-19 remains a way off. How long we'll look at and how drugs that are already out there may be useful. Huge amounts of money have been promised by governments to help with the economic impact of the outbreak. We take a look at 5 different plans. We'll tell you which items are selling out around the world, and it's not just toilet roll. And singing from the rooftops, kind of a musical interlude from those in isolation, thanks to a city in Turkey. And top of our newsfeed, that vital vaccine. Scientists everywhere are striving to come up with a treatment and a vaccine for Covid-19. And some good news, we're closer to it today than we were yesterday.
Scientists are racing against time to find a vaccine to stop the spread of Covid-19. But developing vaccines takes time. Time the world doesn't have. Most vaccines for seasonal flu or for measles were developed decades ago. After the SARS outbreak in 2002-2003, it took about 20 months to go from genetic sequence to a patient being dosed with an effective vaccine. But this time around, the World Health Organization is calling for faster action. At least 20 vaccines are being developed in a global race for a cure, and the first human trials have already begun just 8 weeks into development. Scientists are also focusing on other promising therapies. One of them is the antiviral compound called remdesivir. It aims to prevent viral replication in the early stages of infection. It was originally developed to combat Ebola. Now, animal studies show the drug could be effective against the coronavirus infection. The malaria medications chloroquine and hydroxychloroquine have shown some promise. And a combination of 2 HIV drugs, lopinavir and ritonavir, has also been tried, but according to the New England Journal of Medicine, no benefits was observed with this treatment. The French Biomedical Research Agency says it will coordinate an add-on trial in Europe named Discovery. That will follow the WHO's example. The trial will test the same drugs with the exception of chloroquine. And as technology enables new methods, some companies have started more in-depth clinical trials.
So about a month ago, we started to work on 2 different forms of vaccine. One is the naked DNA vaccine, the other is a protein-based vaccine that are using a new platform technology that is create a Johns Hopkins.
Pharmaceutical companies are also looking to repurpose anti-inflammatory drugs to try and calm lung inflammation.
I think we squandered the first window of opportunity, but we are saying today in my message, I made it clear that this is a second opportunity which we should not squander and do everything to suppress and control this virus. And this is a responsibility for all of us.
But the WHO says trials are extremely necessary, and there's only one thing more dangerous than a bad virus, and that is a bad vaccine.
Now, we spoke to Professor Jason Mackenzie, a virologist who works at the University of Melbourne's Doherty Institute. He told us how long it will be realistically before we get a vaccine, and told us about some of the medicine already out there which may be of use.
So it's really a long process. In reality, you're probably looking at something that will be released next year. That's in a usual scenario. Sometimes, of course, these things can be accelerated. And we did see that a few years ago with the Ebola crisis in West Africa, where a vaccine formulation that wasn't actually approved and hadn't really even been trialed was accelerated into the human sort of trial market and even given as a treatment to some of the people who came down with Ebola. So it really depends on the impact and obviously the concerns, particularly for healthcare workers, how they can defend themselves when working with patients. So In the real sense, yeah, it's probably around a 6 to 8 month or 6 to 9 month sort of time frame, but sometimes there might just be a platform that's already existing, and therefore people can easily get something up and running straight away to sort of try to get something up on the market and to get something into some trials that can prove the efficacy and particularly the safety of that vaccine formulation. So in this case, with Corona and COVID-19, it does look like there are some candidates that can be accelerated into the market, and already we're seeing some going into human trials and animal trials at the moment. You know, we want it to protect against this, obviously, this pandemic outbreak, but we want it to be safe to the people that receive those. So that's usually the big delay, is the time it takes to really determine how safe that vaccine formulation will be. And as I mentioned before, in some cases, if there's a real need and there's really imminent danger from this pandemic, then they can accelerate that further in getting a vaccine out onto the market. There's usually a couple of approaches, and the major problem with a lot of these pandemic viruses, particularly flu, is that they change very quickly and what are called mutate. So we have to be on top of how they can do that, and then try and formulate something that they can't fight against when you re-administer that vaccine each year. So with the COVID outbreak, what we generally try to do, the first approach would be can we make something like a live attenuated vaccine, something like polio, which many of the people in the world have received, where the virus can infect the body, but it doesn't do a lot of harm to the body, but your immune system recognizes it as a threat, reacts very quickly, generates the right response so that you can defend yourself against that virus. So that would be one of the first approaches to have a look at. Otherwise, we can sort of look at what's on the outside of the virus itself, and that's what the immune response sees. So are there bits, if you like, or what's called proteins on the outside of that virus particle that we can make, administer to individuals so that your immune response will recognize that as the true virus, and therefore you'll generate specific antibodies that will target that virus and protect you against the infection. So there's sort of the approaches. We look at the structure of the virus, how does it look like, and then try and identify key parts of that virus itself that we can use as the vaccine that will enable your body to recognize it as a virus and produce those antibodies that can be very, very effective in defending you and the population.
Okay, let's take a look at some other COVID-19 related stories that you may have missed. Hashtag staying safe with Buzz. Moonman Buzz Aldrin has tweeted to show his solidarity with people in solitary. He wrote this after coming back from the moon in 1969. He spent 3 weeks in quarantine and he shared this picture of it. He's asked for his followers to share their own pictures.
Hi everyone, we're the Galballis and Henry here has got a very important message for you.
Stay at home. Yes.
Well, these people are YouTubers and they're telling their millions of subscribers to stay home, part of the effort to reduce the spread of COVID-19. They say that any advertising revenue they make will be donated to the National Health Service in the UK. And this is Sri Lanka, where a Buddhist temple hired a helicopter to sprinkle holy water from the sky. The chief lay custodian of the Temple of the Tooth, who did this, said they hope the virus will be under control after this blessing. The island has had 122 cases, 1 death, and 15 people have recovered from the disease. Well, many nations have now decided they will spend huge amounts of money to try and keep businesses running and provide workers with cash to get through the COVID crisis. Faisal has a look at the approach of 5 countries, starting with India.
The world's second most populous country, India, has announced a $22.5 billion stimulus package. The money will be dispersed through food security measures such as essential items for poor households and direct cash transfers. The measures will affect about 800 million people. Medical insurance of around $60,000 will also be provided to healthcare workers. The world's biggest economy, the United States, has passed a $2 trillion relief package. It includes $1,200 cash payments to citizens, $150 billion to the healthcare industry, $500 billion for state and local governments and companies, and $250 billion in loans and assistance for small businesses. Ireland's government has announced a $4 billion package to guarantee people's incomes. The country has also raised the unemployment payment to $380. It will also run a temporary wage scheme to guarantee 70% of wages, up to $41,000. Another significant move, the country is taking control of all private hospital facilities for the duration of the crisis. El Salvador, the small Central American nation, hasn't announced a specific bailout package, but the government will exempt affected parties from payments for essential services, mortgages, and personal loans. The payments will be spread over 2 years and won't face any interest. Nigeria's central bank has announced a $2.8 billion intervention in all critical sectors of the economy. It will also bring in intervention facilities and loans for the health industry, including for doctors and nurses. It has started a microfinance program for households and small to medium businesses with a $136 million credit facility.
Okay, let's go around the world now for some other stories you need to know this Monday. Well, the Japanese government have caused anger among environmentalists by not making their climate change emission targets tougher. Japan is the only G7 country still building coal-fired power stations, and the government say they are sticking to their target set in 2015 to cut emissions by 26% by 2031. SpaceX have been chosen to be the company which will fly cargo to the soon-to-be-built Lunar Gateway. The gateway will be NASA's staging post for its future missions to the moon. It's part of the Artemis program, which will see human beings back on our near-celestial neighbour by 2024. Well, Harry and Meghan Windsor have left the UK and now say they will live in America. Because Harry was born into hereditary wealth and privilege, it's expected that he will have 24-hour security following him, his wife and his family for the rest of their lives. Donald Trump says the US won't pay for it. The Windsors say they never expected the US to pay. Now, lots of people have been panic buying. You've seen them getting toilet roll by the bulk load, but not all people are buying such silly items. They're buying some sensible stuff too in large numbers. Take a look at this. And last up, social media has been full of musical moments created due to the lockdown. We're going to need a COVID Olympics of perfect strangers performing from their homes while in isolation. And we submit this entry from Sivas in Turkey for their rendition of a Queen classic. Take it away, Tower Block guys. Like a 7 out of 10. That's all from the Newsfeed team. Reach out to me with your questions, comments, complaints and suggestions. You'll find me at Kamali Melbourne. You'll find us 24/7 on YouTube. You can subscribe to that channel and you can follow me on Twitter. Follow, subscribe and add. See you again tomorrow.